for today. So this afternoon we are going to learn about another topic. It is important in psychiatry to understand ourselves as well as our patient lah. Okay, so we're going to learn about defense and coping mechanism. Yeah, all right. So there are a few learning points. Okay, so at the end of this lecture, hopefully you can able to define what is the defense mechanism, and then there are so many types of defense mechanism. So hopefully you can somehow learn a few and can give some definition lah on a few of this type of defense mechanism, and classification of defense mechanism. And last one is we learn about second part of the lecture is coping mechanism and its classification. Okay. All right. So basically, in our life, in our daily life, how we perceive things, whether the things or event that occur to us on daily basis, that's will affecting our what we call a judgment towards that event. So either we first praise the event as something lucky or unlucky to us. It depends on how we perceive that things. So all this perception partly all this perception that cladding that determine our perception. Sometimes it's depends on the defense mechanism that we always practice on daily life. So to start with, the concept of defense mechanism was firstly introduced by this man. This is Sigmund Freud. Okay, and he is known as a father of psychoanalysis. Psychoanalysis, and then his work on its and ego and also defense mechanism was further elaborated and even more research done by her daughter Anna Freud, and afterwards there are a lot of other psychoanalysts, psychiatrists and psychoanalysts that study on defense mechanism work. So basically the idea of defense mechanism came about when Freud talking about this topographical map of our mind. The initial idea was our mind, human mind, is divided into three levels: the conscious level, pre-conscious level, and the unconscious level. It is submerged under the water. Okay, and later he came with a illustration of that topographical mind, which is divided into ego, superego, and id. So these three components play an important roles in how we perceive things and how we react to things that occur to us. So according to Freud, these three components play a vital roles lah. So what is id, what is ego, and what is superego? So basically, there are two extremes. First is the id. We go first by the id. The id is instinctual drives, and this drives was fueled by libido and obey pleasure principles. It means that the id is always wanted something for the benefit of oneself, uh, regardless of the social boundaries, religious boundaries, or moral boundaries. So the id is function and obeys the pleasure principles. And the other extreme is the superego, which obeys the morality principle or the good things, or social or morality principles guided by the social or the environment surrounding a one patient. Okay, so superego is based on the conscience and also ego ideal. So the ideal things that should we do is determined by this superego component. Okay, and uh, in between superego and E is what we call is ego component. Ego component obeys the reality principles, and in the unconscious mind of a person, there is a constant fight or constant argument between it and superego. It wants something, whereas the superego limiting the things, and ego must act in balance between it and also superego. Yeah. So there's here comes about the defense mechanism. How this defense mechanism protect the ego, protect the ego, so that it also protect someone from uh, become anxious, become worried. So we go about how this defense mechanism works. So um, so how the ego deals with the id and superego is by first one is defense mechanism, and then if the ego cannot deal with the confrontation between id and superego, and then the last resort, when the defense mechanism fail, so the person may presented with some symptoms, whether it's a neurotic, psychotic. So this becomes appeared when the defense mechanism fail. So what is defense mechanism? It is an unconscious intrapsychic process, which is a protective in nature and used to relieve anxiety and conflict arising from uh, a person impulses and drives. So the first keyword here is unconscious. Unconscious means that the person is not readily aware about the things that occur in that component. Okay? It's an intrapsychic process, and protective. The duty or the function is to protect and used to relieve anxiety and conflict. Okay? Right. So as I mentioned, the purpose of the defense mechanism is to reduce anxiety, to protect self-security, resolve the mental conflict, and protect the one's self-esteem. Um, right. So basically, this is the repetitive of things that we mentioned before. Okay, everyone use defense mechanism daily, and it's not always pathological. Right? We must remember that sometimes if we use this defense mechanism unconsciously every day, and it's not always become something pathological. It's only become problematic or pathological only if it's interfere with someone's ability to function, or disturb the interpersonal relationship. Maybe someone is too rigid in using a certain defense mechanism, and is not flexible enough in dealing with the daily things that he face or she face. So that becomes problem to that particular person, right? Okay. So this is a few things that we need to have in mind when we talk about a defense mechanism. So basically, defense mechanism is a hypothetical construct from the observation on how the how psychological process that we hypothesize that may occur in that particular person when we observe their behavior. So basically, this is a hypothetical construct lah, right? And this defense mechanism, although we might think that he has mungkin maybe patient this person using this certain defense mechanism, but this does not explain the behavior. Not necessarily is what we call 100% correct. And then for further understanding the behavior behind of that person behavior, we need to assess further lah what causes the person to behave like that lah, right? When confronted with the problems. And this defense mechanism, it helps to overcome the impact of stress when used in moderation. Okay, the keyword here is moderation. And then a normal person use a variety of coping and defense mechanism. It depends on situation. So are we flexible enough to when we facing this type of conflict, we have a maturity to deal with it with good defense mechanism or not? Okay, and then abnormal individual tends to lose to be less flexible. Okay, inflexible, rigid, using the same defense mechanism regardless of situation. So this become problematic. Okay, and then when the one particular or two particular defense mechanism become dominant, the ones the person become what we call not easy to be change their personality as well as and it becomes problem especially with regards to the interpersonal relationship with others. So this is a few defense mechanism, suppression, displacement, projection. We will go through each of these one by one afterwards. And then, okay. So because there are a lot of defense mechanism, so we the psychoanalysts came up with a system to categorize this type of defense mechanism. So the most common use defense mechanism classification is valence. So valence, I mentioned that this defense mechanism can be divided into the hierarchy of maturity. So means from the pathological group, immature group, a neurotic group, and the most mature one is the mature defense mechanism group lah, right? Okay, and the first group is pathological or narcissistic. Okay, pathological or narcissistic defense. The most primitive and usually appear in children and patient with a psychotic behavior. Okay. Second one is immature defense. Maybe seen in adolescent, non-psychotic patient. And neurotic defense, the third group is usually encountered in patient with obsession, hysterical, as well as person under stress. Rawan, can you unmute? Can you mute your speaker? Okay, we go to the first group, pathological or narcissistic defense. Okay, so for this group, it is almost pathological lah, because the name is also pathological. So those who have this kind of defense mechanism usually has some problem with their what we call mind, basically. However, it also can occur in young children and also can appear in adult dreams or fantasies. And this type of defense frequently appear as irrational, most common form in psychosis. And all these 3 or 4 defense techniques share common mode of avoiding, negating, or distorting reality. So it avoids the true reality, and okay, okay, for example, the first one is denial. Okay, denial means consciously avoiding anxiety-provoking thoughts by not accepting reality. Not accepting reality is denial. Okay, so this common. If you look into grief reaction. So the first stage in the grief reaction is denial. So what is example of denial? A lady refused to accept a cancer diagnosis. So patient who had a event being just recently diagnosed to have a cancer. So the first reaction may be she or he denied the assumption or the diagnosis. Okay. Okay. The second one is distortion. Okay, distortion is reshaping external reality to suit inner needs, to sustain superiority and entitlement. Okay, so uh, one person needs to maybe different lah. But here in distortion, they make up things or make up stories to fulfill their hallucination or delusion ideas. For example, a woman tells a story about she was abandoned by family when she was actually run away from home. So basically, she's making up stories to distort the true reality. Okay? What is delusional projection? So here, you might be a bit confused because projection can be in in immature group as well as in pathological or narcissistic group. But the difference between projection here and the projection in the immature group is the severity of the belief, severity of the belief or the level of the what we call conviction. So here, projection ups to the level of a delusion. Okay? So what it means, perceiving or reacting to unacceptable inner impulse as though they were outside the self. So usually on psychotic level, it takes a form of frank delusion. Usually the most common one is persecutory delusion and acting on that delusional perceptions. For example, a man believes that his wife is cheating on him while he himself feels attracted to other women. Okay. He did not say out loud that he had some feelings to other women, but instead he he put a belief that his wife is cheating on him. Okay? So this is a delusional projection. And the last part of the pathological group is splitting. Splitting is common in a person or patient with a borderline personality disorder. So splitting is, I mean by split lah, split into half. The all or nothing, all or nothing. So there is no the gray area. So it's either white or black, or there is no room for ambivalence, ambiguity between these two extreme lah. Okay? So usually this person who practice splitting defense ni unable to integrate the good and bad images of both self and others into cohesive whole. So they cannot think into something more mixed between the bad and goods. For example, one student disliking all teachers and then finding that all student counselors are all good based on the choice of profession alone. So this is a very what we call immature judgment because of their profession alone. So disliking all the teachers and then praise all the student counselors. So this is a splitting, usually commonly found in a borderline personality disorder. Right. So the next group is immature defects. It is fairly common in pre-adolescent years in adult with character disorders, and often mobilized by anxieties related to intimacy or the loss of the intimacy. And excessive use of this immature defense may be seen as socially undesirable because it is immature, difficult to deal with, and out of touch with reality. Okay? So can be seen also in major depression and person with personality disorders. So we let's go to the first example. Okay, acting out. So acting out is expressing an unacceptable or extreme unconscious wish or impulse in action or behavior to avoid the anxiety. So it is always associated with a patient with borderline, antisocial personality disorders. For example, a person throw a temper tantrum, when he or she does not get their way. They want something, and when they does not granted the permission, the person become angry, start to throw temper tantrum. So this is acting out, a major type of defense. Okay. A regression. A regression is a return to a previous stage of development. For example, childlike state to avoid attention evoked at the present level of development. Okay. Usually common in individuals who are feeling tired, ill, or uncomfortable, and this is this always reflects a basic tendency to achieve instinctual gratification or escape instinctual tension. For example, a student stressed up in college start sucking his thumb. So the behavior of sucking his thumb to resemble a childlike state, or a man bringing a teddy bear to the hospital for an overnight admission. So this is a few behavior that resembles a regression. Okay. The next one is idealization, which is imposing more positive qualities on external object or person than they actually have. Means we perceive things more than it should be lah. Okay. For example, a woman believing that her new boyfriend is absolutely flawless, no fault at all. Okay. Next one is blocking. Temporarily or transiently inhibit the affect, thinking, or impulses while feeling increased levels of tension. And it's maybe associated with embarrassment. So we block the impulse, the thinking, when we feel that we start to have tension feeling. Okay. So this blocking defense is close to another type of defense, which is repression. But this blocking also has component of tension arising from inhibition of the impulse. So instead of he or the person try to avoid tension, he himself feels the tension while trying to block that certain impulses. Okay. For example, and a boy being unable to answer a question during the exam. So during stressful condition in the exam, he fails to recall the answer, but immediately recalls it once the exam is over. Okay, next one is introjection. introjection is unconscious assimilation of external object, whether maybe love or hated, into oneself in a symbolic fashion. And the goals of introjection is to ensure closeness and constant presence of the object, and to avoid anxiety of separation. And this introjection is different from identification in terms of the intensity of assimilation. So there are two nearly identified defense lah, which is introjection and also identification. But introjection is more intense in the sense of assimilation. So example, a child absorb the value, preferences, and also attitude of the parents, does become very much like them. So a child imitate everything he learned from the parents, and then when he grow up, he just behave and also have some attitude just like the parents. Okay, so this is introjection. Whereas for identification, unconscious modeling of oneself after another person, conforming to the value or attitude of a group. So this is not less intense compared to introjections. For example, a student respect and admire a professor. That professor has a mustache and smoke a pipe, and then he start to do the same to show his respect and also admiration to the professor. Okay, the next one is somatization. This represent an emotional conflict, representation of emotional conflict by physical or bodily symptoms. And then this is tendency to react with somatic rather than psychic manifestation. So a person who have some stressful, who have underwent some stressful condition, so they may have presented with more of bodily symptoms, pain, rather than what we call here psychic manifestation, or more of feeling sad, feeling anxious. So they presented with more physical symptoms. And usually the body parts that involved is under involuntary control. Okay, so example, an employee who repeatedly been denied promotion in his company become severely angry, and then he develops constant headache. But when he do medical workup, it's all normal. So possibly the constant headache is part of the stress that become part of the defense there lah. The headache as part of somatization. Whereas the conversion, so you need to differentiate between conversion as well as somatization, because these both of symptoms, this both a defense mechanism, a representation of emotional conflict by physical symptom as well. But in conversion, it is more of voluntary control part of body, which is a motor sensory system. So, for example, a father who has strong impulses to injure his child, suddenly he developed a paralysis of one of his upper extremities. So conversion is seen is more patient presented with a neurological symptoms lah. Patient may have a seizure, paralysis of the limb, numbness. Okay, right. Next one is hypochondriasis. Exaggerating or overemphasizing an illness or somatic complaints to avoid responsibility or guilt associated with loneliness, bereavement, or aggressive impulse. So it is possible that a person have a certain physical complaints or physical illness, but the way that the person complained or came about with the symptoms is excessive. So overemphasizing, excessive preoccupation. Okay? For example, a man claiming to be bedridden while suffering from mild abdominal cramps, when actually he's trying to avoid going to work after the death of his wife. Okay? So this is what we call hypochondriasis. Okay? Okay? Passive aggressive is a indirect expression of hostility, whereas where a person expressing aggression towards others indirectly and ineffectively through passivity, failure, turning against self. For example, a woman avoiding answering direct questions because of feeling of annoyed towards another person, feeling annoyed towards another person, so she avoid to answering the questions. So this is a passive aggression. And once again, we came to projection, misattribution of person undesired thought, feeling, or impulses onto another person. So similar to the delusional projection in the pathological group, but here the severity is lesser lah, as compared to delusion type in the pathological groups. And for example, a man who consistently late for work has been suggested by boss to come earlier. Instead, doing this, the person decided to came late but drive faster. But subsequently, he was given summon for speeding. And then he refused to accept the blame, stating that the boss was responsible. So instead of accepting that that was his fault for not coming earlier, for driving faster, so he project the blame towards his boss. And the last one in the group of the immature group is schizoid fantasy or fantasy. It means withdrawal into fantasy and indulge in autistic retreat to resolve inner and outer conflicts. For example, an elderly man who fantasizes that he is useful and virile. Okay? So that's for immature group of defense mechanism. And the third group is neurotic defense mechanism. I think this neurotic defense we can find a lot in our patient that came either is an outpatient or inpatient. Okay, so this neurotic defense is common in normal healthy individuals as well as in neurotic disorders. Anxious person, for those who have obsessive compulsive, it is common. Right? In short term, this neurotic defense can give advantage to someone to cope in a social context, but in long term, it may create problems lah in relationship, in work, when the person only use a certain defense mechanism rigidly. Okay, so we go to the example. The first one is displacement. It is a purposeful, unconscious shifting or transfer of emotion to a less threatening object or person. And then the one that received the that has been displaced may become a scapegoat for others and develop phobias. For example, a person or a student punching a wall after an argument with a colleague, rather than telling the colleague what's the true feelings about him lah. Okay. And second one is a mom showing her feelings of anger towards the children instead of confront the actual problem, which is her husband. Okay, so usually the displacement occur between the one who more powerful to a less powerful person lah. Okay, repression is a also known as a motivated forgetting, which is an unconscious exclusion of thoughts, impulses, or memories, which are often painful from the conscious awareness. And the one who repress is unaware of whatever that is repressed. Example, a man cannot remember all the traumatic events that occur during his time in war. So the man possibly has repressed all the memories. Okay. The third one is reaction formation, which is transforming unacceptable impulses into a polar opposite behavior to avoid anxiety-provoking thoughts. Usually, this reaction formation is common in OCD. For example, a man who has a strong impulses to steal become a police officer who then specialize in theft cases, right? And another example is in individual who is a racist, and then he become extremely nice to foreigner. Okay, so this is a reaction formation. Okay, next one is undoing. Okay, undoing is trying to undo a situation by engaging a new behavior. Mainly, we try to negate the first behavior by doing another behavior, and usually is also associated with CD. For example, after a fight, a husband bring his wife to a romantic candlelight dinner. So he tried to undo what occurred before the fight between them. So he brought the wife to a dinner. Okay, next one is rationalization. Rationalization is making excuses or giving a rational explanation to justify behavior, attitude, or belief to avoid self-blame. And for example, adolescent be blames his poor school performance because the teacher dislikes him, instead of admitting that he did not study, right? Okay. Next one is dissociation. Dissociation is detachment, detachment of a person identity from their intolerable thoughts or activity, so that the individual may defer or postpone the emotional impact of that situation. So it is include the fugue state and also hysterical conversion reaction. Hysterical conversion reaction is just like in hysteria lah. Hysteria that we heard on the news in the boarding school or in a hostel in certain schools. So this is partly due to dissociative state lah. Example, a man driving on a city street accidentally strike a child who suddenly darted out in front of him. So when the police arrive to investigate at the scene, they find the man wandering around in a dazed condition, unable to remember the event. So this is the man apparently may use a dissociation lah, to protect himself from emotional distress. Okay, next one is isolation. This is intrapsychic splitting or separation of an idea from associated effect. Usually, the effect was painful and unacceptable. So, it means that the person accepting reality without the accompanying emotional response. For example, a child who was physically abused, recalling the traumatic events or experience without any display of emotion. So, he just tell the story without feeling sad or feeling traumatized. So just without any emotional response. Controlling is excessive attempt to manage or regulate the environment to minimize or avoid anxiety. For example, a mother not letting her child attend a friend's birthday party unless she can regulate who else will attend the party. So this is controlling. Intellectualization, using abstract, rational, and logical reason to avoid effective expression. For example, a woman excessively investigating pathophysiology of a terminal illness. So after being diagnosed to have a certain terminal illness, the women do some research on that particular illness instead of reacting to the anxiety related to a possibility of early death. Okay. Externalization is perceiving one's own personality in the external world and external object components. So it includes the impulses, the conflicts, the attitudes, and style of thinking. So externalization is more like a projection, but externalization is more general as compared to projection, which is more specific. For example, perceiving someone else as aggressive and he himself as someone peaceful, although he himself actually is the aggressor. So this is externalization. The inhibition is unconsciously determined limiting specific ego functions to avoid anxiety arising out of the conflict with the impulses or superego or the environmental forces or figures. For example, a man was trying to not laughing out loud in reaction to seeing a friend falling on their face to avoid having conflict with the friend. Okay? So this is inhibition. Okay, that's for neurotic defense mechanism group. So we come to the last group, which is a mature defense. And okay, this is commonly found among emotionally healthy adults, and it is considered as a mature and adaptive defense, and it enhances pleasure and feelings of control. Okay, so this type of defense, mature defense, help to integrate conflicting emotions and thoughts while the person is still remaining effective. Okay, so first example is altruism. It means serving others constructively to experience a personal vicarious experience. So once the persons do something good to others, they feel very satisfied with the things that he had done. Right? So it revolves guilty feelings by meeting the needs of others. For example, giving the homeless man your lunch instead of eating it yourself. Second one is anticipation, which is realistic planning or premature worrying about future discomfort. So we anticipate about things that may occur in future, and then afterwards we plan. Okay, so this is associated with goal-directed behavior, which is planning. For example, going over course note in preparation for a lecture the following morning. Okay. The next one is humor. It's using comedy to express feelings and thoughts to lessen personal discomforts, but without producing unpleasant effects on others. Example is expressing a serious situation in the form of a joke to reduce the anxiety. So the ability of joking, why not offending others in a stressful condition is a form of maturity. Okay. Sublimation is a shifting focus of unacceptable shifting focus of unacceptable impulses towards goal-directed activities, and usually towards a socially acceptable direction or behavior. For example, playing sports. For example, a secretary who feels very angry at her boss vigorously scrubs the floor. So thereby getting rid of her anger, ending up with clean and shining floors. So this is a sublimation. Or using feeling of anger to motivate studying for an exam. Okay. The next one is compensation. It means psychologically counterbalancing perceived weakness by emphasizing strength in other areas. Example, a man who has been paralyzed from waist down in an accident becomes a champion in a trap shooter from his wheelchair. So he used his strength from waist upward to become a champion. Okay. Okay, next one is suppression, which is a consciously or semi-conscious postponing attention to an anxiety-provoking thoughts. And usually individuals are aware of the suppressed impulses. So as compared to repression, repression in immature defense, usually they are unaware of the things that they repress, the impulses or thoughts that have been repressed. But in suppression, the individuals are aware of the suppressed impulses. Okay. Example, suppressing feeling of fear associated with the sight of blood during surgery to provide necessary patient care. Okay. So a surgeon may have some fear when see a lot of blood during the surgery, but he suppress the feelings so that he can continue with the surgery. Right. So basically, that's the last example of mature defense mechanism. Right. So this table summarize most of the things that we learned just now. But here, I just like to point out two defense mechanism that has been put differently. In anxiety, you see that acting out and passive aggressive. They put here as anxiety, but according to Valence, this passive aggressive and also acting out, the classification was under immature group of defense. Okay? Right. So we try to see what's the significance, the clinical significance of knowing this defense mechanism. So, according to numerous research studying about human behavior and personality, so these psychoanalysts find out a few common defense mechanisms that are appeared or occurred in certain psychiatric disorders. For example, in obsessive compulsive disorder, a person with OCD usually practice intellectualization, isolation of affect, reaction formation, and undoing defense mechanism. Whereas in psychosis, a patient with schizophrenia, schizoaffective disorder, bipolar mood disorder, so they may have projection, denial, distortion, and also aggression. Okay? And just what we highlight just now when we talk about dissociation, detachment of reality, and it occurs in a case of hysteria. So this is a few other examples. We mentioned about psychosis, OCD, and dissociative disorder. Other example is somatoform disorder, where the patient may practice somatization or conversion defense. In phobia or anxiety, the patient or person may using the avoidance and symbolization. And in depression, a patient may have or use a defense mechanism of turning against self, isolation, and also identification. Okay, that's all for defense mechanism. So we finished with the first part of our lecture. Second part is coping mechanism. So coping mechanism is constantly changing cognitive and behavioral efforts to manage a specific internal or external demands. It means to how we cope with the stressor, the stress that we have, how we cope consciously with the stress that we face. So coping mechanism operating at conscious level, and it can be classified into a few different classification. Whether the first one is adaptive versus maladaptive, a problem focus or versus emotional focus, behavior versus cognitive, and engagement versus disengagement. And sometimes this classification also overlapping with the defense mechanism, according to Lazarus. And okay, according to Portman and Lazarus, uh, problem problem focus coping mechanism. We focus on the problems to solve the stress. For example, taking control, seek information about the problems, and evaluation of the pro and cons of the things that we consider to settle out the certain problems. Whereas for emotional focus, for example, is disclaiming, avoidance or escape the situation, accepting responsibility or blame, exercising self-control, and positive reappraisal. So this is more of emotion based focus in coping mechanism. So we go through a few types of coping mechanism. First one is self-soothing. It means comforting yourself through the five sense organs, massage, perfumes, or other things that you things that you feel relaxed after doing by this type of sensory organs. Okay. And second one is distraction, taking your mind off the problems for a while by having vacation or playing some games, listening to music or watching movies. The third one is opposite action, doing something in opposite to your impulses that is consistent with your positive emotion. So instead of become stressful with that certain situation, we channel it to something more constructive, more something positive. And the fourth one is emotional awareness. So we identify and expressing of feelings. Sometimes when we have stressful condition, we tend to avoid, tend to disregard the feelings. So at some point, we may have become exhausted of avoiding the similar feelings again and again. So this emotional awareness helps us to validate our emotion. At the same time, we noticing it, and we can continue with our what we call daily life activities. And the fifth one is mindfulness, tools for grounding ourselves in the present moment. Mindfulness has various activities or exercise, whether breathing exercise, a mindful eating, a mindful running, or you can apply mindfulness concept in every activities you do in daily life. And the last one is crisis plan, contact information, info of supports and resources when coping skills are not enough. This is a few a slide on how we do emotional validation. Right? We start notice, naming the emotion, we accept the emotion, and then we investigate the emotion and allow and release. So this helps us to facing with the stressful feelings, stressful impulses, without what we call avoiding or disregard the feelings at all. Okay? So as the last slide, how we do see the clinical relevance in studying this defense mechanism and coping mechanism. Particularly defense mechanism, we do practice or identify this defense mechanism in psychodynamic psychotherapy. Right? It's a specific type of psychotherapy where we identify the defense mechanism used by the patient, and then helping the person become aware of what they are using and appreciate how effective the defense after all. And if the defense mechanism is somehow less primitive, primitive or immature, uh, try to imply something a more mature defense when the person having conflict in the near future. And for coping mechanism, it is used in various psychotherapies, counseling, IPT, interpersonal therapy, DBT, dialectical behavioral therapy, IPSRT, stress reduction therapy, mindfulness, and part of PFA or psychological first aid. So coping mechanism is more universal and can be applied in any stressful condition counseling with regards to stress management as such. Okay, I think that's my last slide. Okay, all right. Okay, thank you. Okay, is there any questions? Any questions? Any things that you need to clarification with regards to this defense mechanism? Don't worry, I will convert this PowerPoint into PDF and I will share with your representative later on, so that everyone can have a look, and then can maybe if you want to ask me later, so please do so lah. If there is things that you need for clarification.
Doctor, good afternoon. My name is Wu. I have
Yeah,
a question here. Can you clarify more on what is a rigid defense mechanism?
rigid defense mechanism. So okay, what it means by rigid defense mechanism is not that defense mechanism is rigid, but the application or this the person keep using the same defense mechanism unconsciously when having or facing a different type of situation. Example, um, acting out. We look at the immature defense group acting out. So every time he had problems with other people, he will shoot angry shout at them, acting out, show his real feelings towards them. So whereas if he at the same at the different situation, he can use other a more mature defense. So it helps to what we call dealing with the stress or conflict effectively lah. So rigid here means that particular person use a similar defense mechanism again and again, irrespective of the situation that he's facing with. So I think normal adult mentally health person, we learn about these things to know this type of defense, and hopefully sometimes we can reflect back on ourselves. That's what unconsciously maybe we can we do not what we call, we do not aware when the things happen, but uh, we also can do reflective thinking about what have we do earlier, and then we can somehow find out what are the usual defense mechanism that we use. So if we have a tendency to use the similar same defense mechanism again and again, so it's something what we call rigid lah, and in long term it may become problematic to that particular person lah. Is it okay, Wu?
Yes, thank you, Doctor.
Okay, I will convert the slide to PDF, and I will share to Alif lah, Alif, and then you can share to all your colleagues afterwards. Okay. All right. If there is no other questions, so we shall end our session here. Thanks again. Thanks a lot for your attention. So hopefully this lecture will benefit you in a way in understanding more about your patients, what's behind their behavior, what's the explanation behind their perception or thoughts. So some of this behavior or thinking or perception can be explained through this new defense mechanism we learned today lah. All right. Okay. Thanks again. Okay. So we end here. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Doctor.